Good afternoon, everyone. Welcome to the CACFP Meal Pattern webinar, What Californians Need to Know to Comment. This webinar is hosted by California Food Policy Advocates with generous funding from the David and Lucille Packard Foundation. We have a very full agenda for our approximately 1 hour webinar today, so we are going to get started right on time. Before we get into our presentations, a few quick tips about how to participate in this webinar. As a reminder, you may listen to this webinar through your computer speakers or by telephone. The email you received after registering for the webinar contains the phone number if you are having trouble with your computer speakers. We have over 400 registrants for this webinar, so everyone is muted and will remain muted throughout the webinar. If you have a question, please submit it in your GoToWebinar control panel under the Questions tab. We are recording this webinar, and it, along with other materials, will be posted on CFPA.net. If you are not already, please make sure to sign up for CFPA's Nutrition Action Alert at cfpa.net/subscribe to stay up to date on the CACFP meal pattern and forthcoming materials. On January 9th, the U.S. Department of Agriculture released a proposed rule with new science-based nutrition standards for meals provided through the Child and Adult Care Food Program, also known as the CACFP. The Healthy Hunger-Free Kids Act of 2010 required USDA to update the CACFP meal pattern and better align it with the 2010 Dietary Guidelines for Americans. Under the proposed rule, meals served to children in childcare and after-school settings will include a greater variety of vegetables and fruits, more whole grains, and less sugar and fat. This proposal is the first major update to the CACFP meal pattern since the program's inception in 1968. We have an expert panel for you today. They will be discussing the importance of early childhood nutrition, an overview of the proposed changes, and the importance of CACFP in childcare. Additionally, I will be explaining the commenting process for you. First, we have Dr. Lorene Ritchie, Director of the Nutrition Policy Institute and Cooperative Extension Specialist in the Division of Agriculture and Natural Resources at the University of California. The goal of Dr. Ritchie's work is the prevention of food insecurity, obesity, and diabetes, and the promotion of health and wellness, with an emphasis on the youngest and most vulnerable populations and participants in the federal nutrition assistance programs. Next, we will hear from Kelly Knapp. She is a CACFP nutritionist with the California Department of Education, Nutrition Services Division. She has worked for the CACFP for over 17 years. Then we will hear from Stephanie Clark, who has worked for the CACFP for over 20 years and is a member of the Childcare Food Program Roundtable Advisory Committee for the past 13 years. She has experience in nutrition education and training of childcare providers, children, and parents. Lastly, you will hear from me, Elise Hummel-Vitale, a nutrition policy advocate with California Food Policy Advocates. I work on projects that aim to increase access to the Child and Adult Care Food Program and to improve the licensed child care nutrition environment in California. I started with CFPA in 2010. So without any further ado, I'll hand it over to Lorene. And Lorene, let me give you access to the screen. There you go.
Good afternoon, everyone. I'm very honored and privileged to be here, and I'm so tickled that there are so many participants here on our call. Elise asked me to share with you some of my perspective on early childhood nutrition and some of the research we've done on California healthy beverages in child care law. So I want to start by sharing with you some of the good news, and Elise, it is not going forward, so perhaps you could send me forward. There we go, thank you. We have some wonderful reasons to celebrate. And I'm going to start by talking about the 2010 California legislation, which, by the way, is still the most comprehensive beverage legislation in child care to date. And those of you who have been involved in child care know that it was implemented in 2010. And that law mandates that in California, in child care, and this includes CACFP sites as well as sites that don't participate in the program, so centers and homes of any kind, That law mandates that milk for children 2 and older must be 1% or non-fat, in other words, no whole milk or 2%, and no flavored milk. Juice must be 100% juice, and in age-appropriate serving sizes, no more than 1 serving per day is allowed. Water is available at all times, including meals and snack times. And finally, the last provision of the law is that there are no sugary drinks allowed of any kind, whether they be artificially flavored or flavored with sugar or high fructose corn syrup. And the reason Elise asked me to share a little bit about this particular law is that you, for those of you who have been studying up on the CACFP proposed regulations, will notice that 2 of these are included in the new regs, and in fact came out a little before that in 2011. And I should mention that this 2010 California legislation was implemented in 2012. So the end of 2011, CACFP changed their regs for milk and water, and in 2012 in California we got all 4 of these provisions again for all sorts of childcare. So the next slide will show you that the impact of this legislation and why we think the new CACFP regulations will hopefully have similar impacts is that we studied the changes in water access, for example, in this slide shown here, before that Healthy Beverages and CACFP law went into effect in 2008, and we compared that in 2012 after both laws were in place. And what you can see in this slide, which represents data from all sorts of childcare, family homes, centers, Head Start, state preschools, on the program and off the program, is that water was more easily available for self-serve in childcare, and that result was a statistically significant result, meaning it's unlikely to happen by chance that we saw this increase. We also saw an increase in water provided with meals and snacks. The next slide will show you what happened with respect to milk type. You'll remember that the law said that only non-fat or skim milk and unflavored milks could be provided to children 2 and over, and we saw some significant changes, decreases in the number of sites that were serving whole milk and increases in the sites that were serving non-fat. Interestingly, we saw very little flavored milk in 2008, but it did decrease, although not significantly, in 2012 after the law went into effect. Next slide. You will see improvement in other beverages. So we also saw that there were fewer centers and homes serving juice more than once per day following the Healthy Childcare Beverages law, and that there were fewer sites, although again this one is not significant, but it was going in the right direction, that there were fewer sugar-sweetened drinks being served to children. I'm hearing a little bit of feedback. So if anybody has their cell phone on, it'd be helpful to turn that off.
Lorraine, I'm not hearing any feedback on my end.
Oh, okay. Well, I will have the joy of hearing myself talk to myself. But the other interesting thing about our research study was we asked childcare providers what made it hard for them to serve healthy beverages to children in their care. And what we wanted to get at with this sort of question was what sorts of resources, what sort of assistance could we provide that would make it easier for them to comply with this law. And what we found was actually quite surprising to us. When we asked about all 4 of the changes that were mandated by the California law, over 3/4 of providers said that there weren't any barriers and that they did not find it hard to do. To switch to lower fat milks, for example, to not serve flavored milks, to not provide sugar-sweetened beverages, etc. So we thought this is very encouraging and hopeful for the CACFP regs. Of course, those are farther reaching, but it at least is an encouraging finding. The next slide shows you that while we have much to celebrate specific to childcare, we also have some reasons to celebrate for children in general. And this slide is national data from the National Health and Nutrition Examination Survey. And what it shows for boys and girls and by age group is that for most subgroups, total calories have been going down since the year 2000. And this is the direction we need to see calories going if we're to reverse the child obesity epidemic. So this is very encouraging news. It's not significant, the decrease in 2 to 5-year-old girls, but it is in 2 to 5-year-old boys, and in total for all children, the changes that were observed were significant. The next slide shows you that despite these great strides we've been making, and I applaud all of you for helping to contribute to that progress, we know that we can and we must do better, and I wanted to share a little bit of data that shows just the reasons why. The next slide shows you that although I just praised the progress we've made on energy intake, we still have a ways to go. So according to the DRIs, for a very young, say 2-year-old, who's not very active, they need 1,000 calories per day. For a very active child who's older, say 5 to 8 years old, you would expect that child to consume 1,600 calories per day. And at least if you hit the next button, you'll see that even though, like I said, we've seen declines in recent years, on average, children in the preschool age range consume at the upper end of expected. And so we still have some work to do on calorie intake. The next slide shows where we would hope children to be for fruits and vegetable intake, and those of you who are familiar with my plate know we recommend half your plate be fruits and vegetables, and for children 2 to 5 that is equivalent to 1 to 1.5 cups per day for each fruits and vegetables. But as you can see, as Elise hits this button and the next one, a third of to 40% of young children are meeting those recommendations, meaning most are not, and very few for the vegetable goal of 1 to 1.5 cups per day are meeting that recommendation, less than 13% of 1 to 3-year-olds and 5% of 4 to 8-year-olds. The next slide presents similar data for grains. And by the way, I don't think I mentioned that these data that I've been presenting in the last few slides are also from the National Health and Nutrition Examination Survey, so they're nationally representative, they're not California specific. But we would hope that children's total grains are equivalent to 3 to 5 ounces per day, and their whole grains be half or more. And instead, what we're seeing is that children are at the very upper end of the total grain consumption, and their consumption of whole grains are very much below what we would anticipate, less than 1 ounce. And in fact, only 1% of children nationally in the 2 to 5-year-old age range are meeting the recommendations for whole grains. And finally, added sugar. So the Dietary Guidelines Advisory Committee just came out with a recommendation that Americans consume less than 10% of their calories from sugar, and young children, 2 to 5 in our country, consume 16%. So again, we have a lot of work to do in order to make sure that we get to the goals that we've set for ourselves. The last thing I wanted to share with you with respect to the evidence and the research that has been done over the last decade on the ways to improve nutrition for young children is that over and over again, and actually you see this in all settings, not just child care, but after school care, in-school care, worksite settings, community settings, what the research is showing us is that our best bet is when you combine information and promotion and education on nutrition with a supportive environment. And when those two are highly linked, such as having regulations like the new CACFP regulations linked with education so that children understand why the foods are being provided to them that they are being provided, we see then the best outcomes. So with that, I'm going to turn the mic over to Kelly.
Thank you, Lorene. Next, we have Kelly Knapp with the California Department of Education.
Thank you, Elise. I will be presenting an abbreviated version of a webinar hosted by USDA on January 15, 2015, titled Proposed Rule to Update Meal Patterns in the Child and Adult Care Food Program. Today I'll be covering a brief background of the proposed rule, the proposed meal patterns for infants, children, and adults, proposed best practices, additional proposed revisions, and corresponding changes in the CACFP meal pattern that would impact other child nutrition programs. Elise, I think I'll have you advance my slides. As part of the 2010 Healthy Hunger-Free Kids Act, USDA commissioned the Institutes of Medicine to review the current CACFP meal patterns and provide recommendations that are practical and would improve the nutritional quality of meals. Along with the IOM recommendations, USDA took into consideration the 2010 dietary guidelines and consulted with CACFP stakeholders that included state agencies, sponsors, providers, and nutrition advocates. Recognizing that CACFP operates in diverse types of facilities, that there are varying degrees of resources, and that no additional reimbursement would be provided for CACFP meals, USDA designed meal patterns that are achievable and do not raise costs for providers. Sorry, we're having some slide issues here. Okay. Now we're going to discuss the proposed meal pattern, starting with the infant meal pattern. Next slide. First, the proposed rule consolidates the infant age groups. Currently, there are 3 infant age groups, 0 through 3, 4 through 7, and 8 through 11 months. Under the proposed rule, there would be 2 infant age groups, birth through 5 months and 6 through 11 months. USDA is proposing to consolidate the infant age group so that infants under 6 months of age would only receive breast milk or infant formula in accordance with American Academy of Pediatrics recommendations. The gradual introduction of solids would be allowed starting at 6 months of age. Second, to support breastfeeding, USDA is proposing to allow any child care facility to receive reimbursement for meals when the mother breastfeeds her infant on site. This would apply even if breast milk is the only component served to the infant. Third, USDA is proposing to require a fruit or vegetable be served at snack for the 6 through 11 month age group, and proposing to eliminate fruit juice from being served to infants in all age groups. Fourth, USDA is also proposing to prohibit cheese and cheese products in the infant meal patterns, which includes yogurt. Finally, USDA is proposing to allow ready-to-eat cereals such as Cheerios to count toward the grain component for older infants at snack. Next slide. Here's a table with the proposed infant meal pattern. We're just going to take a quick glance at this table. When the downloadable handouts are available next week, you'll be able to look at this more closely. Before moving on to the child and adult meal patterns, notice that the breakfast, lunch, and supper meal patterns are all the same. Only the snack meal pattern is different. Next slide. Now we'll discuss the proposed meal patterns for children and adults. We'll start by going through the proposed new age group and then the proposed changes for each of the meal pattern components. Next slide. The proposed rule creates a 4th age group for children 13 through 18 years. This was done to better reflect the characteristics of the population served by the CACFP. The meal pattern for the 13 through 18-year-old age group would be the same as the meal pattern for the 6 through 12-year-old age group. USDA is not proposing to increase the minimum serving size requirements for the 13 through 18-year-old age group at this time because it would increase operating costs. USDA plans to issue guidance on how to accommodate the increased nutrient needs of this age group. Next slide. The proposed rule separates the currently combined fruit and vegetable component into a separate fruit component and a separate vegetable component at lunch, supper, and snack. This change would increase the variety of fruits and vegetables that children and adults would be served. The fruit and vegetable component at breakfast would not be separated. Additionally, the total amount of fruits and vegetables required at each meal would remain the same to keep the meal pattern cost neutral. Under the proposed rule, providers would be required to serve one fruit component and one vegetable component at lunch and supper. Because the fruit and vegetable component will be split into two, the proposed rule would allow fruit and vegetable juice to make up the entire fruit or vegetable component at all meals. However, it would not allow fruit and vegetable juice to be served at the same meal and would allow only one beverage, milk or juice, to be served at snack. Next slide. USDA is proposing to require at least one serving of grains per day be whole grain or whole grain rich. To help reduce the amount of sugar consumed, USDA is proposing to require that breakfast cereals meet the WIC requirements. That is, only cereals with 6 grams of sugar or less per dry ounce would be allowed. Lastly, the proposed rule would no longer allow grain-based desserts to count toward the grain component because they are sources of solid fat and added sugars. USDA will provide guidance explaining what is considered a grain-based dessert in the future. Next slide. In the meat alternate component, USDA is proposing to allow a meat or meat alternate be served in place of no more than half the grain component at breakfast. This was added because USDA recognizes that meat and meat alternates are good sources of protein, vitamins, and minerals. This option also gives providers greater flexibility, especially to those providing care for older adults who may have to limit the amount of carbohydrate in their diets. Additionally, USDA is proposing to allow tofu as a meat alternate in the CACFP. Next slide. In 2011, the Nutrition Services Division issued a management bulletin to CACFP sponsors implementing a USDA policy to serve only low-fat or fat-free milk to children 2 years of age and older and adults. The proposed rule adds this current requirement into the USDA regulations, so this is not new. USDA is also proposing to allow only unflavored whole milk for children 1 year of age, and that any flavored milk served to children and adults must be fat-free. This is consistent with the National School Lunch Program. Next slide. In 2011, USDA milk policy, the milk policy memo that I just mentioned also addressed non-dairy substitutes for children or adults who cannot consume fluid milk due to non-disability, medical, or other special dietary needs. It also allows non-dairy beverages that are nutritionally equivalent to milk to be served in lieu of milk for participants with medical or special dietary needs. The proposed rule adds these current policy requirements into USDA regulations, so this is not new either. Additionally, USDA is proposing to allow yogurt to meet the fluid milk requirement for adults no more than once per day. At this time, USDA is not allowing yogurt to count toward the fluid milk requirement for children because milk provides the important vitamins A and D for growing children. Comparable quantities of these vitamins are not found in commercially available yogurt. Next slide, please. This table outlines the proposed breakfast meal pattern for children and adults. What I want you to see here is just that the fruit and the vegetable component continue to be combined at breakfast. Next slide. Here is a table with the proposed lunch and supper meal pattern for children and adults. As you can see in this table, fruits and vegetables are listed as separate components. Under the proposed meal patterns, a lunch containing 2 different fruits, such as an apple and an orange, would not be reimbursable. One of the fruits would need to be replaced with a vegetable such as carrots or green beans. Next slide. This table reflects the proposed snack meal pattern for children and adults. At snack, there is still a choice to serve 2 components out of the 5 for a reimbursable snack. Next slide, please. Now we're going to go through some additional proposed revisions that address meal service requirements. Next slide. First, USDA is proposing to prohibit frying as a way of preparing food on site to reduce the amount of fat served in a meal. To keep this standard flexible and prevent increased costs, USDA would allow all purchased food that are pre-fried, flash-fried, and par-fried to be served. However, they must be reheated using a method other than frying, such as baking or microwaving. USDA will develop guidance to help explain what is considered frying and is seeking input from stakeholders on this proposed standard and encourage people to provide comments on what they consider frying. In 2011, the Nutrition Services Division issued a management bulletin communicating to CACFP sponsors the USDA requirement for drinking water to be available to children throughout the day when requested, including mealtimes. While not specifically required for adults, adult daycare centers are encouraged to ensure adult participants also have access to drinking water. The proposed rule adds this current requirement into USDA regulations, so this is not new. The proposed rule would allow parents or guardians to provide at least 1 food component for children who cannot eat regular meals because of non-disability medical or special dietary needs. The proposed rule also reflects the current family-style meal services best practices that a center or daycare home must follow when serving meals family style. This includes placing enough food on the table and actively engaging children to serve themselves the full required portion of each meal component. Similar to offering water, this is already being implemented and is not new. The proposed rule extends the option of offer versus serve to children receiving meals in at-risk after-school care centers. Currently, CACFP only allows offer versus serve in adult care centers. Next slide, please. In the proposed rule, USDA is presenting several options related to flavored milk and yogurt. To limit added sugars, the IOM recommended that flavored milk be limited and served only to adults and children 5 years of age and older. The IOM also recommended limiting the amount of sugar in flavored milk. USDA acknowledges that foods high in sugar, such as flavored milk, can contribute to excess calories in a child's diet and agrees that the sugar limits recommended for flavored milk and yogurt seem reasonable based on products currently available in the marketplace. In the proposed rule, USDA is presenting 2 options for flavored milk served to children 2 through 4 years of age. First option, prohibit the service of flavored milk, or required flavored milk to contain no more than 22 grams of sugar per 8 fluid ounce serving. USDA is seeking public input on these options. Next slide. USDA is also presenting 2 options for a sugar limit on flavored milk served to children 5 years of age and older and adults. The 2 options are flavored milk must contain no more than 22 grams of sugar per 8 fluid ounces, or the sugar limit is a best practice that centers and daycare homes may choose to adopt at their own discretion. Can you go back a slide, Elise? On top of recommending, there we go, thanks. On top of recommending a limit on the amount of sugar in flavored milk, the IOM also recommended limiting the amount of sugar in yogurt. USDA is presenting 2 options for a sugar limit on yogurt served to all participants of all ages. First, yogurt served must contain no more than 30 grams of sugar per 6 ounces, or the sugar limit is a best practice. USDA is also seeking public input on these options. Next slide. USDA is including best practices in the proposed rule that CACFP providers may choose to follow. Program operators can use the best practices as a guide when choosing to improve their menus and to ensure that children and adults are getting optimal benefit from the meals they receive. While the best practices would be part of the regulatory text, they are optional. Next slide. Under the best practices, providers should support and encourage breastfeeding. This can be done by providing mothers access to breastfeeding materials and educational opportunities, encouraging mothers to supply breast milk for their infants while in care, and by providing mothers who come to the daycare facility with a quiet, private area to breastfeed. Next slide. To limit the intake of added sugars, USDA is also encouraging providers to limit the consumption of fruit juice to no more than one serving per day to children. USDA is encouraging providers to make at least one of the 2 required components of every snack, a fruit or a vegetable, and also to provide at least 1 serving of dark green vegetables, red or orange vegetables, and legumes once per week. Next slide. USDA is recommending that providers serve at least 2 servings of whole grain rich grains to meet the IOM recommendation that at least half of all grains served be whole grain rich. Additionally, USDA is encouraging providers to serve breakfast cereals that contain no more than 6 grams of sugar per serving, which is stricter than the WIC cereal standards. 1 dry ounce, which is the WIC standard, is equivalent to 1/8 cup. Most breakfast cereal serving sizes are 1/2 to 3/4 cup, which is about 4 to 6 dry ounces. Next slide. In response to the IOM's identifying flavored milk as a source of added sugar, USDA recommends that providers serve only unflavored milk to all children and adults, regardless of age. Next slide. USDA encourages providers to serve only lean meats, legumes, and nuts, limiting processed meat to no more than once per week and serving only natural cheese. The Food Buying Guide provides some information on what is a natural cheese, and USDA will provide additional guidance to help providers identify natural cheeses. Next slide. USDA is also recommending that providers limit serving fried or pre-fried foods to no more than once per week to help reduce the consumption of fat. Next slide, please. And finally, let's look at the proposed changes to other child nutrition programs. Next slide. To maintain consistency among the meal pattern in school breakfast and national school lunch programs would be revised to reflect the proposed CACFP breakfast, lunch, and snack meal pattern requirements for these age groups. Meals served to children ages 5 and older would continue to follow the school breakfast and national school lunch programs meal patterns. Additionally, the proposed rule would eliminate offer versus serve for children under 5. Additionally, this proposed rule would require schools and institutions participating in the special milk program to follow the proposed CACFP milk requirements, which includes serving only unflavored whole milk to children 1 year of age, low-fat or fat-free milk to children 2 years of age and older, and non-dairy milk substitutes that are nutritionally equivalent to cow's milk for participants with medical or special dietary needs. Next slide. Thank you.
Thank you, Kelly. Now I'm going to hand it over to Stephanie.
Thanks, Elise. The CACFP is one of the key building blocks for good nutrition and quality, affordable childcare. Everyone benefits because of the CACFP. We'll take a look at 3 groups that benefit. The first would be the children. Elise, could I have you forward that slide? Thank you. So children eat the majority of their meals in childcare, spending 8 to 10 hours a day with a childcare program. So through the CACFP, they receive healthy meals while in childcare. It's well documented that CACFP meals are nutritionally superior to meals brought from home or served at childcare programs not participating on the CACFP. The program also lays the foundation for appropriate lifelong patterns that will assure good health for children, because we serve infants all the way through children 12 years of age. Now the next group that benefit on the next slide is parents. We know that many families struggle to feed their children enough food and the right food. In fact, working parents struggle just with enough time to prepare healthy meals. Instead, parents can be confident that their children receive nutritious meals and snacks in childcare through the CACFP, and they don't have to prepare and bring meals each day. Parents also rely on childcare providers to model healthy behaviors, and parents appreciate resources about healthy eating that they can then copy at home. And the third group on the next slide that benefits is childcare programs. The CACFP is a key source of support for these programs. The meal reimbursement that the programs receive allow them to not pass food costs up to parents, keeping childcare costs low, which working families need. And this reimbursement also serves as an economic stimulus. With that money, programs are buying food, they're using it for labor costs, so they're contributing to the economy. And it also helps childcare programs sustain their business, which again contributes to the economy. So childcare programs want to participate in the CACFP and serve healthy meals, but there are some challenges. So we're going to look at two areas where challenges occur. So on the next slide, the two areas are meal preparation and mealtime. So let's take a look at meal preparation on the next slide. So the first area is childcare providers, childcare teachers. They express feeling torn between spending time with the children in educational activities, play activities, but then also having to spend time in the kitchen preparing meals. This is done every 2 to 3 hours for meals and snacks. And we know that you can't be in two places at once. So their first priority is the children, but how do I prepare a healthy meal? In many of these programs, there is no separate cook to turn to. And so it's usually one adult or two adults that must manage this. Another consideration is children that have food allergies or need special meals prepared for them. This adds to time preparation. And we know parents have strong opinions about what their children should and should not eat. And so childcare providers must manage that when preparing special meals, whether it's for diet reasons, religious reasons, or other preferences. Another challenge is disruptions and distractions. I'd like to paint a scenario for you. I'm the childcare provider or teacher. I'm in the kitchen cutting up vegetables, boiling water, I've just washed my hands to do all of this. A baby starts crying. I'm attending to the baby. Now two toddlers want the same toy, so I have to attend to them. All in all, I want to get back to my boiling water on the stove. I need to wash my hands again so I can finish preparing the food. You can see how this can be a hectic and stressful environment for the childcare provider in preparing meals, but also supervising the children. And the last area is purchasing of the food. Whether that's the childcare provider herself, maybe her husband is going to do the grocery shopping that weekend for them. It could be the childcare director. It could be the teacher of one of the centers. Each of them would have to learn program requirements, some of which may be very complex, requiring them to learn to read food labels, such as sugar counts, what's a whole grain. So again, just another challenge that we would need to be addressed in order for childcare providers to choose foods that are quick to prepare, kid-friendly, healthy, and meet program requirements. Now, on the next slide is the other area that's challenging, which is now we've actually sat down to have meals, and we have different age groups that require different amounts of time to be served. Infants especially require more of our time. They eat on demand. Many of them may even fall asleep while they're eating, and so that feeding time is extended. You can imagine, too, if you have a new child in care who's not used to the routine or the foods that you're serving, they also are going to require more attention on the adult's part. We have different schedules. Breakfast is served at 8, but children roll in at 8:15, 8:30, 8:45, and repeat this after school. Children roll in at different times. And so meal service can be a pretty lengthy time period with different routines. The other area is disruptions as well. If a nap runs long, the meal time now must be later as well. Parents may drop in during meal service. That becomes a distraction. Doorbell rings. All these things are happening 4 to 5 times a day because that's how often a meal service is. So the eating experience can be an educational experience, but it also can be challenging. It's a unique arrangement, feeding young children in childcare. So there are rewards, but there's also challenges. So my key that I put there at the bottom is balancing high nutrition standards with the practical view and reasonableness of implementation and the childcare environment. Back to you, Elise.
Thank you, Stephanie. Next, I want to talk about why USDA needs to hear from you and how you can comment. So, why should you comment? Well, for starters, California has more than 3 million children between the ages of 0 and 5, of which more than 25% live in poverty. Early childhood is a critical time of development. Nutrition habits and preferences are developed within the first 5 years of life. Young children are especially vulnerable to the impacts of food insecurity, with poor nutrition affecting a young child's ability to learn and grow. CACFP is an essential component of our childcare system. Not only does the program ensure young children in childcare receive adequate and healthful foods, but science shows that it also supports the overall quality of childcare. Furthermore, the USDA cannot make any changes to the proposed rule unless they have comments from the public to support those changes. Your voice matters for kids, for families, and for childcare providers alike. Who should comment? From parents to advocates and practitioners, CFPA is encouraging all childhood stakeholders to comment on the proposed CACFP meal pattern. For child care stakeholders, it's important to remember that California has a state law that requires all centers to follow the CACFP meal pattern, regardless of whether or not they participate in the food program. This means that the proposed revisions reach well beyond the 475,000 California children receiving CACFP reimbursed snacks and meals each day. So this is a unique opportunity to share your thoughts and ideas that can really benefit our youngest children in California and across the nation. So under the premise that everyone on the webinar plans to comment, because remember, your voice is very important, I will now briefly explain the rulemaking process and how you can comment. As I mentioned at the beginning of the webinar in 2010, Congress passed a law, the Healthy Hunger-Free Kids Act of 2010, that instructed the USDA to update the CACFP meal pattern. On January 9th of this year, USDA released the proposed rule. This is the official document that announces and explains USDA's plan to update the CACFP meal pattern. This rule, as with every proposed rule from a federal agency, must be published in the Federal Register to notify the public and give them the opportunity to submit comments. The proposed rule for the CACFP meal pattern revisions is posted, and we have until April 15th, about 6 weeks, to submit our comments. There are two methods for submitting comments, either online or by snail mail, although USDA is very strongly encouraging we submit our comments online. To find the proposed rule, you will need to go to regulations.gov and search for the docket number. As you see here, it's FNS 2011-0029. On regulations.gov, when you search the docket number, you will find the formal proposed rule and a link to the comment submission form. You can enter your comments into, it went forward without me. You can enter your comments into a text box and click submit, or you can upload a document such as a Word document or a PDF to the website and submit that way. In your comments, make sure you include your name and your address, that you identify the docket number, indicate the specific section of the document of your document to which each comment applies when possible, but most importantly, make sure you give the reason for each of your comments. Remember, your comments will be included in the record, and each and every submitted comment must be reviewed and considered by the USDA. CFPA, along with several other organizations, including MPI and the Childcare Food Program Roundtable, is working on sample comments to make this process as easy as possible for folks. These sample comments will soon be posted to CFPA's website, the one you see here on this slide. They will be complete comments that you can personalize, sign, and submit. Also, check out our partner sample comments, which are or will be soon posted on the websites also listed on this slide. And then lastly, on the CFPA website, you will also find a one-page fact sheet about how to comment, the USDA's summary of the proposed changes, the slides for today's webinar, and other useful resources. Public comments are critically important to this process. USDA needs to hear from all of you participating in this webinar. In California, we have unique experiences that can help guide and inform the nutrition standards for the child and adult care food program. So that concludes our presentations for the day, and we have about 13 minutes left to answer a few questions. Some have already trickled in, which we will start with, but as a reminder, if you would like to ask a question, please enter it into your question tab on the GoToWebinar control panel and click Submit. We will attempt to get to as many questions as possible, but we will also be releasing a Q&A document on the CFPA website in order to address some of the commonly asked questions. So why don't we go ahead and get started. Presenters, I'm going to direct a question to you, and if you can mute and unmute yourself so we limit the amount of feedback. Kelly, this question is for you. What is a grain-based dessert?
The best way, oops, I'm getting feedback. Okay. The best way to determine what a grain-based dessert is, because we really don't know yet, is to go to your food buying guide or the CACFP crediting guide, the new handbook that was released that we're doing our mandatory training on, by the way. And in there, you'll find something called Exhibit A. It's in the grain spread section of the food buying guide and also the crediting handbook. And look for anything that has a superscript next to the item, either the superscript 3 or 4. And that is my best guess as to what those grain-based desserts are going to be that are going to be disallowed. USDA made reference to that in a comment too on one of their webinars, so I think that might be the direction they're going, but I don't know for sure. They will give further guidance on that.
And Kelly, if you can mute yourself real quick so I can ask a follow-up question to this. This person asked, in a previous webinar, USDA said that they are seeking feedback on defining sweet grain-based items. But in your presentation, you said that USDA will direct and define for us. Can you please clarify on that point?
I would say USDA has encouraged any feedback that you want to give. When you submit comments to them during this proposed rule comment period, address those questions to them or make statements about them, because any questions or comments that you have will be recorded in the comments, and they're for sure read by USDA. I know they said they're going to be providing guidance, but it doesn't mean that they're not going to take your comments before they give the guidance. So if I were you, I would try to inform them what your concerns are. So that could influence their guidance.
Great, thank you, Kelly. This one's for Lorraine. Why are CACFP nutrition standards important for the nutrition of young children beyond their impact on CACFP participating sites?
That's an excellent question. So one of the responses is that in many states, including California, other centers, and in some states even family daycare homes, that don't participate in CACFP are still required to follow CACFP guidelines. CACFP guidelines also in states where that is not the case are considered a gold standard, if you will, for child care nutrition. So others may voluntarily adopt those standards. We also know that there's a lot of turnover and movement of child care providers. So a provider who may be, for example, at a center or at Head Start and learn about the CACFP guidelines and then move to another place that may not be, may take that learning, that education, and that ability to provide children with healthier nutrition with them when they go to other places. So for a variety of reasons, there's spillover of the CACFP recommendations to other child care settings.
Thank you, Lorraine. So here I have a question that I think is most appropriate for me to answer. Did I understand you when you said that all California child care providers are required by law to follow the CACFP meal pattern? Let me be very clear. There is state law in California when you are a licensed child care center, so not all providers, child care centers must follow the CACFP meal pattern. Yes, that is a California state law, and it's also a law in many other states as well. So the next question, I could imagine both Kelly or Lorraine may answer. Why don't we start with Kelly, and then Lorraine, if you have something to add, you can answer next. Can water be offered alongside milk at the table for providers who participate in CACFP? Kelly?
The main thing is that the water cannot compete with the milk. The milk is a required component at breakfast, lunch, and supper. And if you have milk available, that's fine, but it has to be very clear that the milk and the water are not competing with one another as a beverage, because the water, although we want to encourage water intake, is not part of a reimbursable meal. So it really is up to you to make that distinction. It's okay to put water on the table, a pitcher of water on the table, but you would need to have, in order to make it clear that it's not competing, you probably need to supply extra cups for that, specifically for that water too. Or you can have it at a nearby table with a pitcher of water and cups right there, or even a drinking fountain that is at the child's level in that room is considered access to water also. And I'll turn it over to Lorraine now.
Excellent explanation, Kelly. So I would just add that there is no specific rule by CACFP or the USDA that prohibits water from being served at the table with milk or juice. So while we don't want competition, there is no reason that a provider can't also serve water with other beverages. Just like you or I might be served if we went to a restaurant, for example. The other thing I will just bring your attention to are two pieces of research. One is we did a literature review on the impact of water on children's intake of milk and other foods. And while there weren't very many studies in young children, all the literature suggested that that's not a concern people have to worry about. And then the second piece of evidence I will share with you is something Dr. Anisha Patel at UCSF and I are about to publish, where we did a small study in 3 centers where we actually did plate waste measures and measured the volume of milk consumed before and after and the amount of food consumed before and after a 3-week period, where before there was no water on the table and after there was water on the table in exactly the way that Kelly described, where there was a pitcher of milk, there was a pitcher of water, and children had cups and they could pour themselves a milk or water or both. And interestingly, and I guess not surprisingly given that I've already shared the punchline from our literature review, but we found no impact of having water at the table on children's intake of milk or their intake of foods. So it is a best practice, but it's not a requirement.
Thank you, Lorraine. My next question is that we have a couple of these popping up around infant feeding. So maybe I'll start with Kelly, and if anyone else has an answer, to go ahead. So this specific question says, if a parent requests that their child be served a solid food prior to 6 months, may it be served in addition to required meal components? And other folks, maybe you can also address, have asked about how how transition time is addressed and defined in the infant meal pattern.
Those are good questions, and I've been asking those questions too. So I think you're going to want to be sure to comment on that and ask those questions. It's not apparent to me in the meal pattern the way it's being proposed. I don't see where the gradual introduction of solids is really being allowed there. What I understand from a previous webinar by USDA when they were asked a similar question, they said that they won't prohibit parents from providing food to their infants before 6 months of age. For instance, you have a parent that wants to start solids at 5 months. They said for you, the required component for you, the child care provider, would be the breast milk or the infant formula. But if the parent wanted to provide extra food, they said that would be allowed. And then again, you already heard my statement. I'm not really seeing where the gradual introduction of solids is there. One of the concerns I have is that it could require a medical statement to hold off on solids later than 6 months, and that the additional paperwork to our providers and parents would concern me there. So it's just things like that you might want to be commenting on, because USDA has been encouraging everyone to submit those comments and questions, because again, they all get recorded into these proposed rule comments, the ones coming, before April 15th.
Thanks, Kelly. Lorraine, I don't know if you have more to add in terms of the American Academy of Pediatrics recommendation, but in addition to answering that, I'm going to pose one more question because we're running low on time. So if you have something to say on AAP and breast and introduction of solid foods, but then in addition, someone asked, why the strong emphasis on low-fat milk? Doesn't low-fat milk eliminate nutrients from milk? So if you could answer those two questions, Lorraine, and then we'll wrap up.
Sure. So in terms of the AAP recommendation, it is currently recommended that infants are not introduced solid foods until 6 months of age, and there's a couple of reasons for that. Allergy, food intolerances, and even childhood obesity have all been associated to some extent with earlier introduction of solid foods. So that is a best practice, and of course I think Kelly nailed the head on that how that logistically would be handled and how parents could opt out of that. That's for further discussion. In terms of lower fat and non-fat milk, That's quite an area of controversy. In fact, we're proposing an NIH study right now to test the impact of giving young children whole continuing through age 5 versus lower non-fat milk. But the current USDA dietary guidelines state that at age 2, after children have grown and matured brain development-wise, they don't no longer need as much fat from milk as they once did. And the other nutrients that may be taken out, such as some vitamins, some fat-soluble vitamins, those are added back. So the non-fat or low-fat milk will have the same content of fat-soluble vitamins as the whole milk. It's just that there's less fat in it.
Thank you, Lorraine. I'm sorry that we weren't able to get to all of the questions. There were a lot that were submitted, but do remember to check the CFPA website for a document that will address the commonly asked questions. So I want to say thank you to everyone for joining us today on today's webinar. As I just said, please check out CFPA's website for more information and updates, and feel free to send your questions or feedback to elise@cfpa.net. Thanks so much, and goodbye.